This is Jeremy with Clarity, and in this video, we're going to be going over the brainstem, specifically the cranial nerves on this brainstem model. Now first, to get oriented, this is the anterior aspect of the brainstem. Therefore, this is the posterior aspect of the brainstem. Since we're talking about the cranial nerves, most of what we are going to be looking at is on the anterior aspect of the brainstem. And since this is the anterior aspect, everything on this side is left-sided structures, while everything on this side is right-sided structures. Now getting into the cranial nerves, these are our optic nerves, left and right respectively. Nasal hemiretina fibers from each optic nerve cross over at the optic chiasm, and then they continue on within the optic tracts. Here is cranial nerve 3, the oculomotor nerve, cranial nerve 4, the trochlear nerve, cranial nerve 5, the trigeminal nerve, cranial nerve 6, abducens, cranial nerve 7, the facial nerve, cranial nerve 8, the vestibulocochlear nerve, cranial nerve 9, the glossopharyngeal nerve, cranial nerve 10, vagus, cranial nerve 11, the spinal accessory nerve, and cranial nerve 12, the hypoglossal nerve. Now, other general anatomy around these cranial nerves, we have the cerebral peduncles of the midbrain. Here we have the pons, and here we have the medulla oblongata. Therefore, the three general subdivisions of the brainstem are visible on this model, specifically the cerebral peduncles when we talk about the midbrain, but here we see the pons and the medulla oblongata. Here are pyramids of the medulla oblongata, and here are olives of the medulla oblongata. Therefore, the olives are lateral to the hypoglossal nerve, while the pyramids are medial to the hypoglossal nerve. Here we have the infundibulum of the pituitary gland, which connects the pituitary gland to the hypothalamus. Here are mammillary bodies, and here is part of the corpus callosum. Here we have part of septum pellucidum, which is in between each lateral ventricle. And that wraps up a little bit of the general anatomy of the anterior aspect of the brainstem model, but more importantly, it hits where all 12 or 11 cranial nerves are on this model from 2 to 12.